Welcome, everybody. Glad to have you. I'm Neil Cavuto. Health and Human Services Secretary Kathleen Sebelius may be talking about the healthcare law in Georgia today, but as premiums spike and insurers run, did Harry Reid just say all of these failures were by design? On PBS, Reid was asked if the U.S. would eventually scrap an insurance-based healthcare system altogether. Here's what he said.
Obamacare is a step in the right direction, but we're far from having something that's going to work for.
So eventually, though, you think we'll work beyond the insurance system?
Absolutely, yes.
All right, well, don't say I didn't warn you. I suspected, and Dave, I'll raise this with you, when I was covering the vote and the debate on the Hill, that this was ultimately the goal anyway. And even though that some Democrats had expressed disappointment that we didn't end up getting a single-payer system, that it was like a Trojan horse deal ultimately leading to that. All right, to FBN's Charles Payne and Town Hall's Katie Pavlich on how it's all playing out. Well, Katie, obviously they've kind of tipped their hand here that this was eventually, might be still eventually the goal. Are you surprised?
I'm not surprised. You're very good at predicting things like this, but
Totally.
this, yes, of course.
It's not about
all
me.
You know everything.
My name is still on the show, isn't it? All right, but anyway, what are we to fear from that?
Well, it's a death by 1,000 cuts. So we're seeing insurance companies, big insurance companies pulling out of this as states implement these insurance exchanges, companies not willing to submit their customers to fraud through these exchanges. We're seeing employers cut the 40-hour work week. We're seeing unions in the Bay saying we need this to be changed. And the solution to all of this is to say, look, Obamacare didn't work. The only option to fulfill our promise of giving health care to everyone is a single-payer system. And let's not forget that when Obamacare is being debated, we had a lot of people on the left who were upset that Obamacare didn't go far enough to be more like the British-style system. And people voted for it based on this idea that eventually would lead to a single-payer system.
But to make it more palatable to Republicans at the time, memory serves me right, Charles, because you were on this as well, you had to sell it as we're not going to debunk the entire system. Right. We're going to keep it the way you know it, so you can keep your doctor, you can keep your insurance company, yada, yada. But if that was the goal, it is panning out that way.
Well, you're absolutely right. And, you know, you're almost loath to say, okay, you know, this was designed to be such a train wreck that it would ultimately take them to where they want to go. But this is certainly taking them in that direction, without a doubt. And here's the thing, though, guys. It was actually sold, too, as some sort of an economic elixir. And then after it passed, we were told, hey, listen, forget about all the economic benefits of it. It's about mankind. It's about fairness, you know, this whole middle-class bargain, and everyone gets health care. So the dollars and cents aspect of it doesn't matter. So they've got to go back and figure out how to resell it again to a single-payer system. Again, maybe somehow tugging at the heartstrings without, by the same time, mitigating the impact it's going to have on our wallets, because it will be, you think it's a nightmare now, as Nancy Pelosi says, wait until we learn more about it.
All right, but to say that I wasn't the only one, you know, warning about this earlier on. I mean, the administration and top Democrats who were pushing for this were embracing this idea before for political expediency. They turned from it. I just want you to look at what were some of the goals of then Senator Obama and other Democrats.
I happen to be a proponent of a single-payer universal health care plan. Everybody in, nobody out. A single-payer health care plan, universal health care plan. That's what I'd like to see. But as all of you know, we may not get there immediately.
I believe the goal here is to create whatever legislation we have in a way that could be developed into something like a single-payer system.
I'm all for a single-payer system. Eventually. I think what we have to do, though, is work with what we've got to close the gap.
Unless, Katie, you could say what we've got is a bunch of insurance companies gouging you through the nose. The insurance companies don't do themselves any favor. You know, their costs have gone up to cover 30 million people, those with pre-existing conditions, and this plays out almost to script.
Right, but what they never talk about is how to lower prices without government intervention. So tort reform is one thing that we haven't seen. You know, the reason why insurance costs are so high is because doctors and insurers have to pay for their insurance to cover these lawsuits that they have to take care of. But in terms of what the system was set up as, you know, they never talk about the implications of what it means to have a single-payer system. Nobody's talking about the report that just came out of England showing 13,000 unnecessary deaths since 2005 as a result of government single-payer system system over there because of a lack of care. And that's one thing I think people need to know. And I think because you look at the poll numbers, Obamacare has never been popular at all. And I don't think that people are really going to go for an overall government takeover of the system. And
unless Charles, they get so tired of the way things are going with their premiums, they'll say, we need relief from this.
Maybe. I mean, that's the wild card, Neil. You know, already the president removed the employer mandate because the last thing he wanted was small businesses who probably have the highest public opinion approval rating of any little subsector out there to whine about this going into the midterm elections. But it's going to be a tough one. I think a lot of people out there who were thinking that, you know, all of a sudden I'm going to get this wonderful care. There's a big difference between having health care insurance and having health care. And I think a lot of people who think that if they want, they're going to go to the doctor and say, Doc, check out my knee, my elbow, my back. 3 years ago, it hurt my hip. A lot of people are going to go out there and say, whoa, this isn't what the president promised me. It could backfire big time.
Do you think this is just, we're saying they're too clever here, that maybe they just by accident stumbled into something that looks like the system as we have it is imploding, and we might get to this way, but this was not their intent at the beginning.
Well, that's what they're going to do. They're going to blame the insurance companies. They're going to go back and say the evil insurance companies are still raising your prices when really they were lower before we got Obamacare and the Affordable Care Act.
And to your point, they stopped a lot of common sense things. Tort reform, state to state, you know, barriers. There's a Walmart of healthcare insurance out there. If they would level the playing field and people can do it interstate and things like that. It's really a simple free market solution. That
but you wouldn't pitch the name Walmart to them. Come up with.
No, I don't think
that's already taken.
I don't know. Fresh Direct comes to mind. But all right, guys.
Costco. They like Costco.
They like Costco. Thanks, guys, very much.